I think for me, my journey started from saying, well, if you're going to start to give more direct payments out, if you're going to change things, if your contracts are going to alter, how are you going to map all that finance, how are you going to manage the spend, how are you going to estimate what you're doing, and also how are you going to limit the transactions for people? Because the old system is very service-led, it's very specific, you can have things in a certain way, you've got to pay for things in a certain way. And in the new way, if you want to demonstrate that people can live an holistic life and have choice of control, you've got to minimise the transactions, and not just the financial transactions, but the conversations that lead to those transactions. Micro-commissioners have lots of different things that they want to do, and it's about being enabling to get that happening, and we're really getting there now. I've been allowed to be right in at the forefront, which is why my job's developed from being just finance manager into transformation lead. And it's that real synergy between what happens on the shop floor, speaking to social workers, and the financial bits behind it. And now with self-directed support, because you tell people about the money at the beginning, the money's in it from the beginning. So the finance needs to be in it from the beginning. So you need to know how your financial flows are going to alter. You need to know what impact it's going to have if you've got block contracts or if you've got your own in-house services. You need to be aware at the beginning, from a financial point of view, what impact the choices people make are going to have on those issues. So getting in right at the beginning is really fantastic for me, because councils, social services departments and adult social care departments sit within a really wide council framework that has a really overarching financial regulations to stick to. And it's about how do you pull bits of money out to let people really, really go out and do what they want with it and it not have an impact somewhere else. So that linking finance people in who've got that finance background and that way of thinking enables other people whose profession it isn't, either social workers, but also other finance professionals, say from a wider area, to be able to really understand what the changes mean for people and to be able to feed that back. At the start of personalisation, we focused on self-directed support, and my initial involvement was around creating a resource allocation system which enabled people to get the money in the right way to enable them to have choice and control. I think at the early stage it's really around having a framework to hang on to. So what you really need is you need to think about the stages of getting engagement and stakeholder engagement. So you'll start with your leadership and then move down to your members, you'll move down to your communities. That's the real resource bit at the beginning. So if you've got the resources to employ people to have project management, that's absolutely great, but you need a framework to hang on to. The actions that I take as a finance professional when I'm creating systems or bringing in new initiatives, what impact is that going to have on the person? And I think when we very first started out on our journey, we did the training for personalisation and self-directed support jointly with myself and social care professionals. So we delivered it together. And what we tried to say to everybody is, whenever you're struggling around this initiative, this changing process, which is inevitably very difficult, just take yourself back and imagine it was you. I think that's the biggest thing that I've learned as a finance professional, is that you've got to go back to how it's going to impact on the individual every time. Chris, can you do me a favour? If I just give you some dates and times, can you look for some meeting rooms for me? It's around deploying the resource that you get as a personal budget in the way that best suits you. So if someone wants to take a direct payment and they feel that they're not able to manage the payroll, for instance, then they can go to a support provider. It's around taking that personal approach. Every person will be different. And so it's around, at the very early stages, identifying what someone needs, what type of support they need, and making sure that it's there in existence for them to be able to do that. So once you've got that environment where people can make choices, then what happens is the challenges come around, well, what am I going to spend my money on, what can I buy? So to enable providers to be really engaged, it's about involving them to tell them what's changing. And it's around getting yourself into a position where you're not tying your money up into blocks that you can't walk away from as people choose to take their money elsewhere. People can either take it as a direct payment or they can get it commissioned, and it's around having that choice. Set out into spreadsheets and sort of like progress sheets and working notes. We're integrated with community services here, and we've really used that opportunity to embed sport and recreation and health and wellbeing and museums and libraries into our day-to-day working. So our colleagues in community services that have always been in the council never would have spoken to a social worker. We've now got workers in individual teams, and people in those community services area think about individuals from a social care point of view and people who are vulnerable just as much as they did with their general customers who walked through the door. So we really started to get that mixed right.
Yeah, thank you. Is there any way you can do it?
From a finance perspective, I think what you need to be really, really clear about from the outset when you're going into a transformational journey is about what you currently do now. It's really, really important to have a real handle on your costs now. My hope is that personalisation doesn't just become another process, that the person remains at the heart of it, and that we create IT systems and operating systems that enable people to take choice and control.